Hello and welcome back to our KYJ series. We are doing the alphabet. If you've missed the previous episodes, we've done the letter A, the letter B. It feels like Sesame Street, doesn't it? Today, the letter C. In the series, we're going to cover 5 jargon, 5 terms that you may be familiar with, you may not be familiar with, but this is really just a bit of a fun walk through the alphabet. Today, letter C. Let's get started. The first C is really topical. This one is calcification. Now, calcification is an interesting term. Intuitively, you know that if something is calcified, it means that it's hardened. But in the context of a medical diagnosis or a medical symptom set, we would refer to calcification as the hardening of usually a blood vessel wall. Now, of course, I can have calcified lesions, I can have calcified skin, I can have calcium deposits and calcification of bone or hardening of the bone. But in the context of particularly cardiology, calcification is one of those things that is giving us a little bit of a crystal ball into the potential that somebody could have a rupture of one of their coronary plaques. So, if we can go back to the concept that the atheroma, the fatty cholesterol-rich plaque that grows on the inside of our arteries, over time can become harder and harder and harder. This calcification is not caused by calcium that's circulating in the blood per se, but it's caused by microscopic little cracks that occur within that plaque. And part of the inflammatory process, that inflammation that occurs, causes each little repair to become harder with each repair process. So every time you crack a little plaque, every time you get a little bit of an injury inside your vessel wall, you repair that damage, but that damage becomes scar tissue, and that scar tissue becomes hardened and calcified. So that first C is calcification. Bit of a long one, sorry. So chronic obstructive airways disease, COAD, chronic obstructive pulmonary disease, COPD, or if you're across the ditch in my homeland, New Zealand, then CORD is sometimes used. All the same condition. I'm going to refer to it as COPD. COPD is ultimately a diagnosis of any one of 3 chronic respiratory conditions. And those chronic respiratory conditions are chronic bronchitis and emphysema, and occasionally asthma is thrown into the mix as well. It's almost certain that if somebody is being diagnosed with COPD, they have a dominant feature, and so they will be dominantly somebody who's experiencing chronic bronchitis, or they will be with a bit of emphysema, or they will dominantly somebody who is experiencing emphysema with a bit of bronchitis. And then, of course, asthma sits in the middle. So we're now doing a great big long video now on COPD, and we'll unpack COPD in another episode. Chronic bronchitis is a chronic inflammation of the bronchioles, upper airway, big pipes, trachea, bronchi, large bronchioles. What this means is that we're going to have a chronic inflammation and scarring and hardening and a loss of elasticity within those bronchi walls. This causes ballooning, or bronchiectasis is the term for it, ballooning of the airway, which means that we have to shift more dead space just to get fresh air down into our alveoli for gas exchange to take place. For this reason, then we would say that gas trapping has occurred. So it's not a blockage like with a plug of mucus. When we talk about gas trapping in COPD, it's a ballooning of the airways. In emphysema is a little bit different. That's occurring in the alveoli themselves, and with chronic inflammation inside the alveoli, enzymes in the inflammatory process, particularly one called elastase, causes destruction of the alveolar septum, the little wall in between any 2 alveoli. And this creates a bubble or a bulle on the inside of that patient's lung. It makes their entire alveolar clusters less elastic. They can't therefore get their lung empty effectively to be able to refill. So that gas trapping leads to carbon dioxide retention. Again, an obstruction to being able to breathe effectively. Chronic obstructive airways disease, very complex. We need a whole video series just on that one. If you agree, let me know in the comments. I'm keen to do one if you're up for it. Okay, seems to be everything we're doing in our C list all comes from the chest, which is probably poetic considering chest starts with the letter C as well. This next one is called costochondritis. Anyone that's experienced costochondritis is just nodding their head right now, because this is not a comfortable place to be at. Costos means ribs, chondra means cartilage. So costochondritis, itis means inflammation. So reading all of our medical words backwards, costochondritis is an itis, an inflammation of the cartilage between the ribs. Now this occurs with muscle strain. If you overworked muscle group in your chest rib cage, then you could be left with 3 or 4 days of feeling quite a large amount of, like you've overdone it, quite a large amount of pain across your chest. Sometimes it can spook people into thinking that they're having perhaps a cardiac event. And that said, you should always have your chest pain checked out. Always have it checked out. Never just think, oh, it's just a bit of costochondritis. It is a classic inflammation that's associated with exertion. So most people with costochondritis will get better in the space of maybe a week to 2 weeks, and some simple anti-inflammatory medications like non-steroidals or paracetamol tends to be all that's needed. That's it. If you get it, you don't know what's going on, you really should get that chest pain checked out. Costochondritis. Okay, our fourth C is corticosteroids. Now this is a family of medications that are used as anti-inflammatory drugs. The word steroid is a little bit of a throwaway, and you're probably thinking anabolic steroids like testosterone and some of the androgens that are used in the bodybuilding community or the muscle building community. And no, that's not what corticosteroids are. So corticosteroids are, the word steros means fat. So they are a fatty hormone, a drug that's produced that mimics a fatty hormone that's produced in your adrenal cortex, and that chemical is called cortisol. So your adrenal gland makes a number of different cortisols, a number of different cortisone-like molecules, and it uses them for many functions, and we could probably do a whole video on cortisones. But if I wanted to give you a medication to mimic your cortisol, to mimic your own cortisone, drugs like hydrocortisone and prednisone and methylprednisolone and prednisolone and dexamethasone and fluticasone and budesonide and all of these medications, these are corticosteroid medications, and they're used as anti-inflammatory drugs. They do have a number of side effects. All drugs have side effects, costs and benefits, and if you're really interested in that pharmacology stuff, I can highly recommend that you jump on and do our online Rusty Pills pharmacology refresher for nurses and paramedics. That's available online in the link that's in my bio. And the last one, it gives me a gut ache to think about this one. This is colic. Now, colic's a pretty old-fashioned, generic term. It's not terribly medical sounding. Colic means obstruction or blockage. So if we usually use it in the context of biliary colic and renal colic. So let's talk about both of those in the context of this. So if I had an obstruction in my common bile duct or in my biliary tree of a gallstone, a bile stone, when my gallbladder contracts and I try and pass bile into my duodenum during digestion, that spasm can cause an immense amount of pain, and we would call that biliary colic. In the context of renal patients, a person who has a renal or a kidney stone that can get blocked in the ureter or the renal pelvis, causing an intense amount of pain. That pain's referred to as colic. Colic. There we go. So that's our C's. We've done 5 C's today. Obviously tomorrow we're doing the letter D. Give me some suggestions on some of the D words you want me to cover. And we'll talk soon. See you later.